Okay, great. Okay, I think we'll probably get started now. Since I see that we have most of the attendees signed up, and I want to make sure that we use our time the best that we can. So thank you all so much for joining us today for this awesome Q&A. I'm super excited to see so many of our community members who have joined here on Zoom, and I hope that some of you are also tuning in via Facebook Live. I'm so excited to also have a fantastic group of experts here from our science community to chat and answer some of our questions today. So for those of you who don't know me, my name is Kimberly Grilling. I am the Interim Executive Director of Evidence for Democracy. We're a nonprofit, nonpartisan organization that works to promote the use of science and evidence in government decision-making. And we're really excited today to be having this fantastic panel. So for all of you, I'm sure you know that science and research has a critical role in responding to COVID-19. Research is helping us to understand the disease and how it spreads, looking into treatments and vaccines. Our medical professionals and our scientists are helping us conduct our work, support testing, treat patients, and communicate science. It's also really important that during COVID-19, we have adequate resources to respond to COVID-19, including PPE, testing, and research resources, and the development of new technologies to help us support the fight against COVID-19. So what we wanted to do today was to have some of these experts who are running some of the initiatives to sort of coordinate scientists across Canada in response to COVID-19 to talk a little bit about how the science community is responding and also answer some of the questions from our community. So before I introduce our amazing panelists, just a couple of housekeeping things. So because we have a big group attending today, what we're going to do is keep everybody muted on the Zoom call to avoid there being a lot of interference. So I'm going to be doing sort of an intro of each of the panelists. They'll each have a chance to sort of speak a little bit to how their communities are responding to COVID-19. And then we'll do a bit of moderated Q&A on our end. But we're also going to be taking questions from the chat. So I'm going to make sure that we have at least 20 to 30 minutes for questions from the community. But if there's a burning question that you have that comes up as we're sort of chatting, you can pop it into the chat box and I'll address it as we go. I think that's all. So I think what we'll do is we'll get started with our panelists. So I'm not going to introduce them formally. I'm going to give them a chance to introduce themselves one by one. So I think what we'll do is we'll start. Oh, before we also get started, I also just want to flag that we are also taking questions in English and in French. We have Marie here who is going to help us with any translation that might need to happen. So feel free to ask your questions in either one of the official languages here as well. So yeah, I think we'll sort of get to it. And we're going to start with Masha Sema. So Masha is the policy advisor in the Office of the Chief Scientist, Dr. Mona Nemer. And in the past weeks, we've seen the CSA as well as the government take some really great steps in response to COVID-19. So I'll turn it over to Masha to tell us a little bit about what's happening there.
Hi, everyone. A pleasure to be here. Thank you, Kim, for the intro. So just a little bit about myself first. As Kim mentioned, I'm a policy advisor with the Office of Chief Science Advisor of Canada. And I've been in this role for 2.5 years now. My background is in biochemistry, microbiology, and cell biology, and from U of T and Hospital for Sick Children. And I further steeped my policy chops through a few fellowships at the World Health Organization, at the Canadian Food Inspection Agency, and the Public Policy Forum. So that's my intro. In terms of the role of, and the goal for me for this presentation is really to provide a high-level overview of Chief Science Advisor's engagement on COVID-19. So I think one important thing that I should start off, and if there's one thing that you remember, that's it, is that her role is really to provide science advice, advice on the latest science around COVID-19, as well as on government response around the scientific activities to the Prime Minister and the Cabinet. So that's the key. She also has this role in science communication and engaging with the media, and so you might have seen her, on radio and TV on Quirks and Quirks. Though this is the main thing. Now, one person cannot know everything, and this is a very complex emergency that we're involved. So I'm just going to summarize the activities that support that advice function and kind of simply group them into 3 clusters. One cluster would be on her international engagement. on lateral engagement or cross-sectoral engagement in terms of engaging with top academics and also heads of federal departments. And the third big bucket that I can speak most to is the, her engagement with the experts in cross-disciplinary experts in the fields. So I'm going to talk a little bit about each of them. So on the international front, the other countries have chief science advisors as well, or analogs. And since January, actually, there's been a regular meeting between chief science advisors recently as frequently as once a week from 16 countries. And it's a very valuable place to exchange information. Some of the countries that are participating have been through the pandemic kind of ahead of us, like South Korea and Italy. And others are kind of in the same shoes. So that's one category. The second category that I call lateral engagement, it's really active outreach by the chief science advisor to the leaders of scientific community, people like CEOs of research institutes and hospitals, organizations like CFAR, Quebec analog, Quebec chief science advisor, but also people in the government, heads of Health Canada, public health, as well as granting councils, kind of individually through coordinate efforts and through CRCC, Canada Research Coordinating Committee. And then the third category that I think is extra important and that I'm supporting is the engagement with experts. So Chief Science Advisor has established an expert panel to advise her on COVID-19 in early March. And since then, the expert panel has kind of branched out into multiple additional panels. And, she's really kind of taking advice of the multidisciplinary experts, Canadian experts, on this outbreak. One thing I wanted to mention would be a good segue to the next panelist is one of the ideas that came out of this expert panel was the researchers were feeling that they needed a space where they could talk to one another, people who work on COVID-19, to coordinate, to collaborate, to share infrastructure. And they kind of call it this one-stop shop where they could, turn to. And Mona has asked Kara Tannenbaum as well as Sarah Gallagher to look into this. And under their leadership and leadership of a few others, this became CanCOVID. So just to summarize, the three buckets that I was describing are really about international engagement, engagement with leaders, like cross-sectorally, and also with the experts. And this is to support science advice to the government, really. Yeah, that's it for me. Thank you.
That's fantastic, Masha. Thank you so much. And I think you said it best in that this is a great segue into our next two panelists. So we're super happy to have Kara Tannenbaum as well as Sarah Gallagher. So Kara is the Departmental Science Advisor for the Department of Health, and Sarah is the Departmental Science Advisor for the Canadian Space Agency. And both of you have been very involved in sort of getting the CanCOVID initiative up and running and leading on this initiative. So I'm going to turn it over to the two of you. Maybe we'll start with you, Kara, and Sarah, you can sort of pitch in as well after Kara to sort of speak to the CanCOVID initiative and what we're trying to achieve through that. Oh, Kara, you're muted.
You'd think after all the Zoom calls, I would know to unmute, but I was so engrossed in what everyone was saying, I forgot. Hi, everybody. My name is Kara Tannenbaum. I'm a physician and a researcher and a scientist, and most recently the Departmental Science Advisor for Health federally. And so to build on what was just said, it's been an honor and a privilege to be part of some of these expert panels trying to inform government about the best decisions that could be taken based on science to address the COVID response. And yet during some of these expert panels with Mona and her group, two questions kind of arose. One was, and you have to imagine now, picture it's 4 weeks ago or even 6 weeks ago, actually. And we're saying, well, Canada's going to need a seroprevalence study. At some point, we're going to have to check for herd immunity. At some point, we're going to have to re-enter society. And how are we going to know how to do that? Maybe we'll need a cohort study. We'll need to sample the population. And I said, oh, but there's so many great scientists and researchers out there who already have existing cohorts for other studies, like the Canadian Longitudinal Study on Aging, like the CanPath study, like so many different cohorts. How can we get these researchers to talk to each other and to not sort of start from nothing and say, here's existing Canadian, breadth and depth of knowledge and I would say resources. How can we bring that together? And that's where the idea, I think, started to have, 21st century way of communicating, collaborating and coordinating in a time where conferences don't exist anymore and regular structures of meetings don't exist. And I think that was probably the spark for CanCOVID. At some point, we also said, there's a lot of questions being asked by a lot of people, and there's even scientists, in Halifax working on a vaccine and scientists in Vancouver working on a vaccine. And do these people know what the other one is doing? And maybe they could help troubleshoot and problem solve together. So I would say that was another reason why we wanted to start the platform. And then here I'm just going to be super frank. Those of you who know me know that sometimes I'm a little bit not political, so forgive me. But the other thing that kind of struck us in the leadership of CanCOVID, and I will say that it was myself and Sarah and Mark Daly from Compute Ontario and Alex Michailidis from the University of Toronto, who are all forming kind of a leadership team on this. We said, well, isn't this open science? And isn't this supposed to be like, excuse me for saying this, but why expert panels? Who gets tapped? Is it just kind of who you know in the vision of getting out of, and I don't want to call it the old boys club, but you keep on going back to the same experts, but there's such a breadth of experience from young folks, from policy analysts, from diverse groups. How is everyone's voice going to be heard and fed up to those making decisions? And we felt that in the spirit of open science and equity, diversity, and inclusion, could we somehow change research culture? And that's kind of the vision behind CanCOVID. We seek questions from above, and I'll elaborate on that in a little while. For instance, as the departmental science advisor, I speak to the Deputy Minister of Health regularly. And so I ask him, well, what's the question this week? What's your priority this week? And then I could post that and we could crowdsource answers and feed that up. And we could talk a little bit about that. Now, this was the vision. Unfortunately, I am a Luddite. I'm just going to say that. And I had no idea how you create this virtual space. And Sarah, maybe I could give you a minute just to kind of say what is CanCOVID and how this virtual space exists. And then after Sarah talks, I think we're going to go to Guillaume and Tara. And there are a lot of things that this platform is not. It's not particularly outward facing. It's really meant kind of for this private conference, and maybe that's a good thing or a bad thing, but that's where I think Tara and Guillaume came in and how we started collaborating on really bringing together, I don't want to say the whole world, but at least Canada. So this is an ambitious vision. Sarah, do you want to say a word about how we operationalized it?
Yes, absolutely. I'm happy to do that. So my name is Sarah Gallagher. I am the science advisor to the Canadian Space Agency. And you might be thinking, what does an astrophysicist have to contribute to this? And what I have to contribute to it is that I am used to open science. Astronomy functions in a really open science kind of mode. And I'm used to working on really large collaborative teams. So it takes a really big team of diverse expertise to fly a space mission or to build a telescope or to decide what you want to do. And so I feel like that's the expertise that I'm bringing to the table. And also because Tara is going to the hospital. She is treating COVID patients. She did it yesterday. And I'm not doing that. So this is also a way for me to contribute to something that I care about very much, but I do not have the scientific expertise to bring that to bear. But I have systems engineering, and I have collaborative work, and that's the skill set that I can bring to the table. And so the way we're actually operationalizing CanCOVID is that we're using a platform which is called Slack. And you can think of it never used a collaborative platform before. It's basically like having a bunch of chat rooms where people can interact with each other. They can discuss, they can present, they can post new research, they can ask questions, they can get help, they can work together on collaborative documents. For example, briefing notes, recommendations. For example, we did a recommendation for the province on how to manage and important data. So those sorts of things, this kind of a platform is actually incredibly efficient and allows people to work together collaboratively very efficiently, and in order to basically make things happen. So I don't want to take up more time. I'm happy to answer questions about the platform in practice, but I really want to give Tara and Guillaume an opportunity. So we are partners with them. Before we launched Can COVID, we met with them and we sort of determined the scope of our different activities to make sure that we had synergies and we could work together collaboratively. And I think it's been a fantastic collaboration. And I want to pass off to them so they can talk more about their efforts.
That's so awesome. Thanks to both of you. It's a very cool initiative and it's great to hear more about it. So I'm going to now pass it over to Tara Moriarty and to Guillaume Bourque. So both Tara and Guillaume are professors at U of Toronto and McGill, respectively. And since, I guess, the beginning of COVID-19, the two of them have been involved in creating a portal called COVID-19resources.ca. So I'm going to turn it over to you guys to tell us a little bit about that work and how it links up to everything we've been chatting about so far.
Thank you. This is really interesting. I understand more about every single aspect of the response as a result of being here than I did before. So you're educating me as well. So I'm Tara Moriarty. I'm an infectious disease researcher at the University of Toronto, and kind of like Sarah, I don't have a direct scientific contribution to be able to make to the COVID-19 effort. I study Lyme disease normally. But I and many other scientists, it turned out, felt that it was important that we be able to try to contribute and try to take some of the load from our public health and clinician colleagues in this response. So to explain how I started on this, so as an infectious disease researcher, I knew before the government shut down, or before a lot of things shut down, that it was going to happen. So I had already planned to get my lab sort of out of the lab, doing our analysis at home in advance. And I was had finished that process and was thinking a lot about what I wasn't seeing yet in the Canadian response, or the things I was worried about. And one of them was that, because as an infectious disease researcher, I've been following this since the beginning through Twitter and other places. I knew that in South Korea and Germany, for example, one of the very early signs in the response was the large-scale mobilization of researchers and development of innovative responses to COVID-19. And what I realized, since I had more time to think at that point, was that I wasn't really seeing that happening in Canada yet. Now, it may not have been because it wasn't happening, but because I wasn't seeing it yet, and I wasn't, the communications weren't clear about it yet, which is understandable in a crisis. So I guess what I was thinking about a lot was that an epidemic, it's very important to respond quickly as well as you can, but speed is important. And I'd been thinking a lot about what Don Lowe had said when he was talking about the response to SARS, which is the importance of informal communications. And so I started signing up other scientists, others within Canada, who might be able to contribute and to help in a sort of preemptive fashion, just in case this wasn't going on at a government level, and was shocked by the number of people who responded, from from undergrads up to emeritus professors, people in mining and fisheries and all over the place. And we have about 4,000 people, volunteers, signed up now for this process to be able to help if needed. And the first night that we were out doing this and talking about it on social media, I met Guillaume, who in parallel was starting to try to think about how to manage the vast flow of information about research in Canada on COVID-19, and he can explain. So we started working together the next Saturday morning at 1 o'clock, and we've been working together ever since. And Guillaume can explain what he's been doing or what we're now all doing together.
Sure. Merci Tara. I'll speak in English, but ça va me faire plaisir de répondre à des questions en français à la fin, s'il y en a aussi. So thanks a lot, Tara. Yeah, so just to follow up on what was said before, I'm also not a COVID-19 researcher at all. So my expertise is in genetics and genomics. I work at the Genome Center at McGill. And just to give a little bit of story on how I got involved into this, I spent 1 week at home, thinking that this was going to be a new quiet life. Although I can continue as a researcher, I'm lucky because I work on bioinformatics. So actually my team can continue to work. We're analyzing data. And so again, the first week was kind of quiet and I was like, this is good. But I also felt like I wanted to help. And I got into this because I was seeing all of the emails flying around about people in particular looking for reagents, for instance. So as people were gearing up to ramp up testing for COVID-19, there were all these emergency emails being shot around. And what I do in my day job is organize data and build portals and things like that. And so I was curious to see if I could actually help build a system that would be more efficient than just emailing back and forward for this in particular. And before doing anything on that, so I met Tara on Twitter, asking her. That's how we connected, because I was just curious to know if somebody else was trying to set up something, and that's how we connected. One part of the story that Tara left out, which I think is important, is that she got started on her side with her brother, so who's not a scientist, but she got her brother to help her in what she was doing in the beginning. And similarly on my side, I ended up using my partner who was at home helping me because I was trying to manage too many things at once. So the group that Tara mentioned that sort of set up this portal really was a group of volunteers from all over Canada. We never met. A group by now of 20 to 40 people, and we're meeting as subgroups and groups almost daily for different aspects of the portal. But just taking a step back for a second and explaining what it is that we did. So the idea was really to try to summarize and also crowdsource the information for researchers working on COVID-19. So Tara talked about trying to gather volunteers. So her part was really to just try to gather information about people like myself and potentially some of you who wanted to get involved in this, whether, depending on, you can have different type of expertise, but might still have a way to contribute to the effort. So she really worked on that aspect initially, as I mentioned, with her brother, her two brothers, setting up something to gather a database of volunteer. My idea was more to say, well, what about funded projects? What about people looking for reagents? So if you visit the website for COVID-19 resources.ca, you'll see that we're just trying to gather information that's relevant for a researcher working in this space, and then also have a way to crowdsource such that we don't have all the information, but you can then also submit additional information. And the idea is not to necessarily replicate anything that's out there, but to point to additional resources. So one big component, for instance, of our website is actually just links to other initiatives, because I think by now we've identified more than 150 other websites and other initiatives. And the idea is not to replicate that, as I said, but just to have a single portal as well to gather. So just maybe just to wrap up, so we talked about many things, but just to take about the link with the CAN COVID platform and the fact that, we started this in parallel, but ended up actually meeting and in some ways merging the two initiatives. The CAN COVID initiative is really a great virtual platform, as was described by Kara and Sarah, for people to really discuss and ask questions and interact. While on our side, we are building a portal that's a bit more static, but sort of is a summary of some of the information that we felt was relevant. And in both cases, I think it's really open to the community as a whole to make suggestions and to contribute. So I'll stop here, but happy to take questions.
That's all so fantastic. And thank you all for sharing these amazingly creative and responsive initiatives. It's been really fantastic to see this all happening. So I think I'll ask a couple of questions, and then I think I'll start taking some questions from the audience as well. So the first question that I have for the panelists is that you've really spoken to these fantastic initiatives. And we've heard sort of broadly how they work, but can you speak to some of the successes that you've seen as a result of these initiatives? And I guess maybe more broadly, what's the responsibility of the science community at this time? Like, what are some of the specific ways that science and researchers are coming together to respond to COVID-19 through these platforms?
Sure. Do you want me to take a stab at that first?
Go ahead.
We've had a number of early successes, and they're very broad ranging. I think Sarah mentioned interaction with the Ontario Ministry of Health. So they posted a portal called Panther, which is to have data available to modelers and scientists to be able to predict surge capacity in hospitals and transmissibility of the virus. And they posted the data for the province, and they came to CanCOVID and said, so is this the right way to do it? And did we make the right data accessible? And is it in the right format? And we quickly organized a meeting with the modeling, what we call channel, or the modeling theme, or the modeling group of researchers on CanCOVID, and set up an interaction where they provided feedback saying things like, well, you don't actually have the individual level data, or we don't know what region it's from, or are we able to link that to the electronic health records, because a lot of primary care sites actually collect data on patients that we're not seeing in hospital that you didn't post. So it would be really much more helpful and give us a better view of the problem to be able to inform strategies going forward if we had that data available. And they were super thrilled with that response, and they've gone back and modified that accordingly. Another example is we've been really careful to have a diversity representation. And so we have First Nations, Métis, and Inuit representation on the platform. And Sharon Edmonds, who's the Inuit representative on our governing council, was telling us about the fears that many northern communities have about COVID getting up there. They don't have the healthcare personnel. They have crowded living facilities. And she was concerned about testing and mobile labs being accessible in the north. And so she posted a question and, can someone help, or do you know what it takes to set up a mobile lab and what kind of diagnostic reagents? And we were able to reach out through environments, through fisheries and oceans, through new kind of testing kits to find out what would be the best way to do that. And so we're facilitating the science behind setting up mobile labs in the north. Sarah, do you want to tell the story about our Public Health Agency of Canada briefing note, or?
Sure. Yeah. Thank you, Kara. So that's an example of where we have we're getting questions in both directions. So I'll give an example of where something bubbled up from the communication that happened on the platform. So there are a number of people. The different research areas are organized by what are called channels on Slack, but they're all open, they're public, so anybody can listen in and on the discussion and contribute. So as a member of the steering committee, I had been listening in, and I saw this issue bubble up on several occasions, which is that in terms of a lot of the health data, no one was consistently or even at all keeping track on data on racial and ethnic identity. And this has been identified by the research as being really important in terms of the health outcomes. And this just kept bubbling up. And finally, there was another announcement that was posted on a channel that everybody can access. And so this is clearly an issue, and it's important, and we're in a position where we can bring these issues that are coming up from the researchers where they don't have the information they need, and we can try to make a difference. And so I gathered the researchers together, and we made sure that we had representation from different groups of people, including the Indigenous researchers, and we drafted a briefing note. Now, I have zero expertise in this topic. So I was simply bringing people together and creating basically a forum where they could share information. And there was incredibly lively discussion. It was really interesting for me to watch, and people were so engaged, the people who were contributing. And we drafted a briefing note, which then we shared with the Public Health Agency of Canada. Kara shared it with them. And then the Public Health Agency of Canada was very receptive to this, and they asked if they could pass it along. And as a consequence, the briefing note went all the way up to Dr. Theresa Tam. It went to Statistics Canada. And so this is an example where the research community had identified there was a problem. Because of CanCOVID and the connection with the departmental science advisors, we were able to share it with people who then can hopefully implement these important changes. And so that was, for me, it was a fantastic example of success. And it was so rewarding to see how engaged the researchers were. They were so happy to be able to contribute and to make a difference. And I think that that is an energy that is often people don't have an outlet for. And so CanCOVID provides an outlet for that kind of energy where researchers can really contribute to making a difference. So so that's my favorite CanCOVID success story.
That's amazing. Did any of our other panelists want to add anything before we move on to the next question?
Oh, maybe I can quickly.
I can
quickly give one. Just in terms of one of the example of the sections in our website is on funding opportunities, because again, there was lots and lots of opportunities that are being offered to scientists, both at the national level, but in some cases, some regional opportunities as well. And it was at some level a bit difficult to track all of these and to identify them. So this has been one section of our website that I think has received quite a bit of attention in terms of collecting these types of funding opportunities. And it's also one where we've actually made a bridge with CanCOVID specifically, because within the CanCOVID space, we now also have a way of getting suggestions and also highlighting specific funding opportunities that might be relevant for the different groups to actually get resources to support their various ideas and projects. So that's one example where I think we also see the synergy between the two websites and the two platforms.
I'll perhaps add something else as well on our end, very quickly. In terms of the international collaboration between chief science advisors, these collaborations seem to happen at all levels. So this is one kind of an international example out of the meetings between the chief science advisors analogs. In mid-March, a call for open access to COVID-19 related publications and associated data and other coronaviruses came out. 16 countries signed it, and it was very well received by the publishing community. It was a call for the publishing community for those who haven't done that yet, to make all relevant publications open.
That's awesome. Great. So that's really amazing, and it's great to see so many successes coming out of these platforms, even though they're all very new. So my next question is, I know that many of you saw that recently the government announced a new over $1 billion science and research strategy around COVID-19. So I think maybe I'll start with Masha on this one, since there was also an announcement of a COVID-19 task force as a part of this initiative. But broadly to all the panelists, what will this new money mean for Canada's COVID-19 response? So I'm going to turn it over to Masha first, since part of that, like I said, part of that response was a task force around COVID-19 that Mona is on. So I'll start with you, and then maybe the other panelists can speak as well to what these new financial investments will mean to our scientific response on COVID-19.
And I can speak to it a little bit more broadly as well. We were really pleased to see the announcement kind of 1 month after a previous, investment in science. Definitely science and research is needed. There's a lot of unanswered questions right now, and our capacity to manufacture vaccines is, we need to reinforce that and be self-reliant. So a lot of really positive investments. Usually the way it works is there's an announcement, but then you kind of find out more about what it means kind of separate places. And so I personally don't know exactly how all of these will be kind of funded and what exactly it means. For the immunity task force, there's a great website that was just put up a few days ago that I highly recommend, that maybe you guys can include in the notes, that has a very excellent Q&A, COVID-19 Immunity Task Force. But basically the role of the task force is kind of multi-pronged. One is to look into basic research in terms of immunology, immunity towards the virus. A lot of questions we still don't know. So there's this element, but also element of serosurveillance in different Canadian populations, geographically, and different professions, etc., over a period of 2 years to test around 1 million people. And right now we're still early stages. My understanding is that tests are still being tested to see, what would be a reliable test to actually do this, because we heard about some tests that were used that were not great quality and hard to interpret data. But Mona's role, she's on the leadership task force, one of the ex officio members. The whole membership has been announced a few days ago, so it's 10 some plus minus people, and under leadership of David Naylor and Catherine Hanks. Other exciting initiatives, all of them are quite exciting, but I'm excited about the genome stuff, the CanCo gene and investments in looking into the viral genomics and also patient genomics, and see if virus mutates, and are there any particular genes or things that make people have more take it harder or easier, as well as a number of other investments in clinical trials that we actually need to finally get to the point where we might have access to therapeutics or a vaccine or multiple vaccines to deal with this. So I'm going to pause there. We have very qualified experts on the panel to comment on this as well.
Yeah, maybe I'll turn to the rest of the panel. From your perspectives, what will this new investment mean in the work that your groups are doing in response to COVID-19?
Well, I think it means two things. One, practically, it means that more money to do more research will, hopefully, that's the anticipation, be able to get us answers more quickly. So I've just been kind of scanning the questions, are non-symptomatic people who had COVID developing antibodies? Well, we believe yes, but perhaps there'll be a study that, sees to what extent, and does it confer the same immunity for as long? We don't know those answers. So we need research money to be able to answer those questions. On an indirect level, what I think is going to happen with this research investment is that we're going to develop a whole bunch of new experts pretty quickly, because a lot of researchers are pivoting to try to contribute to the response, which means reading everything there is to know about COVID and, getting up to speed on what the science is telling us, which for me hopefully means much more activity on the CanCOVID channel. It also creates new opportunities. So I see another question about why are we only doing single molecule clinical trials, which means why aren't we only testing one drug at a time? Well, Health Canada only approves trials that researchers submit. So if a Canadian does not say, I want to test or participate in 5 drug trials, then it's not going to happen in Canada. So that really comes from the researchers, and the expectation is that, for instance, the 2 people who posted those questions, if you go on to CanCOVID, join and post those questions to the researchers there, I think that's where, hopefully there's still 3 more days to submit your applications to CIHR. Maybe somebody's doing that. So I think it's fabulous news. Is there a risk of throwing too much money at a problem? I mean, there's never been so much money thrown at a single problem in the whole world in our lives. We do try and expect to still have high quality research, but in order to reduce redundancy, avoid duplication, and really amplify efficiency, the goal of our platform is hopefully to get people to work together faster, quicker, in an accelerated fashion, instead of everyone doing the same thing.
That's fantastic. So I see Guillaume has a hand up. So
well, I just wanted to do a small follow-up to what Masha talked about. So I mentioned that I work in genomics, and specifically genomics can help in understanding the spread of the virus by sequencing the virus and things like that. And to me, but in order to do that, those experiments, we need funds. And the idea that the federal government is actually funding those initiatives with some level, no questions asked, really, like sort of standing behind scientists to say, yes, do those experiments. We need this data to better inform and make decisions. It's amazing. I mean, I feel very fortunate to be in Canada and have that level of commitment and response.
Tara? I see Tara has a...
Yes, yes, I'd like to say, independent of COVID research, I think that it's also extremely important to remember that scientists in general can be contributing to the COVID effort in multiple ways, not just through doing research, but through contributions to scale up of diagnostics. A lot of this organizational work and person power work, that there's an enormous need for capacity. And some of this is going to be simply about scientists or graduate students or people with, quite advanced analytical and research skills doing things like helping to collect information, willing to be a cog in the wheel and not necessarily do the research itself. And so, for example, right now we're starting an initiative to provide volunteers to one of the people who goes out and who counts every single long-term care and residential home, seniors residents in Ontario, to find out how many people are actually dying. And they are posting that information every day, but it takes about 60 hours a week. And so we can do a call out and find 15 volunteers in Ontario who are going to go check those places every single day, and by crowdsourcing provide that information. And that helps journalists, it helps the general public, and this is something that scientists can do as well. So it doesn't always have to be just COVID research.
That's fantastic. So I'm going to turn over to the chat because I see some really great questions coming in. So one of the questions that I see in the chat that I think is a really good one is, do these initiatives also include technology? So things like PPE innovation, technology support, social distancing, or are there separate initiatives for tech? So I see Sarah with her hand up. I'll give you a stab of that one.
So I'm going to speak about the activities that are happening on CanCOVID a little independently of the actual funding initiatives, because I think Masha's in a better position to answer that question. So what I will say, so there's a couple of ways in which we're trying to bring in a diverse community. We have researchers from social and behavioral sciences, and they are already posting questions. They're worried about the mental health of healthcare workers. They're worried about communication tools that will help us communicate with different populations, including Indigenous populations, about social distancing and the measures that protect public health. We also have an industry group so that we can bring in industry. As Kara mentioned, a lot of researchers are pivoting. That's also true in industry. A lot of companies are pivoting and trying to repurpose their expertise into actively developing new technologies for COVID. So we have both engineers, research engineers from universities, as well as industry players, and we're connecting with MyTex, with industry, with ICED, in order to bring everybody to the table so that they can share their relevant expertise. So yes, we are definitely pursuing. That's definitely something that's happening.
I would give an example. For instance, I do work in the hospital taking care of COVID patients, and there's a one-size-fits-all mask as part of the PPEs. And quite frankly, it slides right off my face, but I'm not so bad. But there are many Asian healthcare workers who work with me, and they've had to start taping the PPE masks to their faces because it simply doesn't fit them. And so on the CanCOVID platform so far, people have volunteered adjustable straps, but more importantly, our industry channel has connected me with 3 different companies that are working on developing adjustable masks as part of the PPE kit. And so right away, we see the connection between a clinician and industry folks who are trying to find solutions. And I think that's a very telling example of how would they even know that if I hadn't posted about that experience. So that I think has really been successful so far.
In terms of funding technology companies and retooling existing industries towards providing PPE and other relevant things, there was a separate call much earlier, I think, at the kind of towards middle of March, and significant financial supports to enable the manufacturers to produce things we really need. So that has been addressed, I would say, and it's Innovation, Science and Economic Development, the department that leads that work. They also have a website where you can submit as a company. You can, if you want to volunteer and you feel like you have expertise that's relevant to COVID-19, you can put in your information, and I don't know exactly what happens and who gets back in touch with you, but you kind of say what your expertise is and what you can do, and then there's this repository of that available to the federal government to use. Yeah.
Amazing. I'm also seeing, so there's a couple of questions here, and I'll try and summarize them into one. So it sounds that the public who are attending this panel are really sort of surprised and happy to hear about all these things coming out. But someone asked, as a member of the public and a scientist not involved in these initiatives, they were concerned about things like the lack of data on racial and ethnic identity. And they were surprised to hear that there was actually a lot of behind the scenes data happening on these kinds of questions. So I guess the question is probably more specifically for Kara and Sarah. Are there ways that the public can follow along what CanCOVID is working on? And what are you guys doing to ensure that there's transparency and public engagement on CanCOVID? Sarah, I'll start with you.
Sure. So absolutely, we are interested in sharing with the public some of the exciting and important work that's happening. And so we have been actively working on a communications plan. We are a very lean operation right now. So it's as with the COVID-19resources.ca, it's basically volunteer and in-kind contributions. So that's one of the things that we are in the process of developing. And one example of something that we're planning on doing is sharing some of our success stories. So with the public in general. We also have a seminar series as well, in terms of if the public is interested in following along, where we have experts who are working in different parts of the COVID-19 effort who are presenting on what they're doing, and then there's also a question and answer. So those all of those seminar series are recorded and they're posted on YouTube. So that's another way in which you can find out what's going on. And but absolutely, communications are an important part of what we want to do as well.
I just want to say that I'm planning to tune into the next two seminars because they sounded awesome.
No kidding, me too.
Yes, today's is about the clinical trials, the launch of clinical trials in Canada, and it's very important. Be a very important talk and very useful.
That's amazing. So I'm going to ask a question from the chat as well. And I think that, so I would assume that a lot of folks who are tuning in today are probably in this pool. So I'm going to ask this one. So the question is, I'm curious to hear what the panelists think about what the role the next generation, and more specifically student researchers and trainees, will play in fighting COVID-19. They're a really important part of the community. And this question is about what we're hearing from the community is that they want to help, but they don't know how. So what do the panelists have to say about the trainee side of things?
If I can start.
So that's something that I think about a lot. Oh, yes.
Yeah, go ahead.
Okay. No, I was going to say, we think about this a lot. We've been, so certainly there potentially are lots of roles for students to contribute to contact tracing, to contribute research skills that they have. For example, we're trying to support other initiatives with data information collecting that allows them to fill a role that may not yet be formally held by public institutions. So that is something that is very important, and that many members of the general public can contribute. So this is a lot of what we try to do, and we also try to post a lot of initiatives where people can volunteer or contribute to the COVID response on our website so that they can play a role, even if it's not matched exactly to their skills and experience. There are a ton of opportunities out there, and we're trying to post all of them so people can find a way to help. And I'll go to Masha now.
Thank you. I have two things I want to say. One is very specific to our office, so maybe just for the panelists, kind of applies to a smaller group of youth, and then broader comment in general. So some of you might know that the Youth Council for the Chief Science Advisor has been recently announced. It's a long process. There are over 1,000 applicants, actually. You can see how many engaged, youth there is. And because of COVID-19, the first in-person meeting was canceled, so it was really too bad. But, I understand that there was recently they actually did come together virtually over Zoom, just like what we're doing right now. And that there will be advice on how COVID-19 is affecting youth through this panel, as well as perhaps other initiatives that come out of the youth themselves. I heard that maybe something around misinformation, but I'm not quite sure. I think this still has to be worked out.
Yeah.
So this is about Chief Science Advisor's office. Now, more broadly, just because I still quite relate to my younger self, I feel like this is a wonderful opportunity to learn. This is like maybe it's a one in a life, let's hope once in a lifetime event, but there'll be more of these things in the future. So I would recommend, absolutely get involved, do things, but also just learn and pay attention of how things are evolving. We're trying to solve this problem as it presents itself. I found it very interesting to follow some of the parliamentary committees on health and see the line of questioning from the political, members of parliament from different parties, how they understand. There's scientists who come to present. There's also other groups who present their perspective on COVID-19. I think it's a brilliant learning opportunity that you will use in the future in other type of emergencies where your help might be needed. And I think one piece of advice that I have broadly is what I observed is people who get the most impact or the biggest impact are those who don't not only see the problems, but also see solutions. And when they see something needs to be done, they actually do it. Like all the other panelists here, as an example. So that's my 2 cents on this. Thank you.
So that's amazing. These are great answers. So I've seen a couple of questions along these lines. So maybe I'll ask it broadly. So I know that a lot of the folks who are listening in today are experts in their own fields, whether that's scientists or trainees or software developers. If someone's listening in and they feel very, mobilized by this conversation, what are some ways that the science community can actually take action and get involved in some of these initiatives if it's something that they're passionate about? We'll start with you, Kara.
Well, I say be part of the solution. And I think that the solution is something that we're co-creating together. That means moving beyond silos. It means moving beyond the regular communication channels. It means thinking big. It means contributing. It means if you're an eligible member to come onto the platform, the CanCOVID platform, then get on and don't just watch. Don't just expect something to happen. Make it happen. Ask questions, start your own policy briefs, suggest ideas for who to submit them for. I'm telling you that if ever the voice of the community could get up to policy and decision makers, it's now. But standing around and waiting for somebody else to make it happen is not going to achieve what we want to achieve. So for starters, I would say that if you're members of the public or patients, I'll let Tara maybe take that one. There's lots of volunteer work that could be done. We have a patient engagement channel on our platform, but be part of the solution. That is really my message for people today.
Yeah. I would say from what I've observed on social media, in particular on Twitter, is that there are these people and these individuals and grassroots groups who have sprung up over the course of this crisis that are playing a really huge role in providing information, and they are, many of them, still doing it on their own. And these are individuals often who had nothing to do with this to begin with, who said, I am going to go out and figure out how to count every one of the long-term care deaths in Ontario and the seniors residences in Ontario, and I'm going to figure out how to report them. And some of the people who are doing it now are, a teacher and I've actually, he'll kill me if he hears me, a developmental biologist, I believe, and they got together and they collect the information. They provide a pivotal resource. There are many organizations and groups where people said, there's a need, we need to do something we don't quite know how to do, but we're going to throw ourselves at it, which is kind of what Guillaume and I did. And people can come and talk to us, for example, if you're at that sort of scale and you're not necessarily someone who could be part of CanCOVID because you're not a researcher, but maybe find other people who can help. This is how Guillaume and I did this, and we have more and more people coming in, and find people who can help show you how to do it or get you volunteers or people with the skills to do it. And then if you see a need, just start and find other people who can help you with that. And that's exactly what we all need right now. While institutions are still trying to respond, we need to fill in holes and gaps, and we all need to be very proactive and not wait for it to be saved, essentially. Yeah.
I'll maybe also put in a pitch for E4D on sort of helping with that policy connection side too. If you are someone who's interested in sort of getting your concerns out to the policy community, we can help you with engaging your elected officials. We can help you with how to communicate science or how to write an op-ed and things like that. That's a tool that we offer to our community as well. So if you're not familiar with the fact that we do that, we're happy to help on that side as well. Yeah, so I'm sort of trying to summarize some of these questions since we only have a couple more minutes, but I think one of the questions that maybe will be a nice way to sort of round out. Kara, at the very beginning, you talked about how you see this CanCOVID platform being sort of an introduction to doing more things like open science, which is a really interesting kind of positive spin on all of this that's happening. So maybe I'll ask you, how do you think that this pandemic and some of these initiatives that are happening as a result of this will change the future of science and science advice going forward after COVID-19 to help us deal with similar problems in the future?
I think that a lot of things are going to change as a result of this pandemic. What I tell my patients when I call their families and say, your grandmother was just diagnosed with COVID, and I say, if I had a magic kind of ball, you know, I'd be able to see into the future and tell you exactly whether she's going to be able to fight it or not. I can't predict how this is going to change advice going forward, but my hope and expectation is that through these platforms, through this engagement, through this recognition by the public and government that science is the answer, hopefully this will really change the playing field on which advice is sought, the mechanisms through which it's sought, the open way of giving advice, and the respect and recognition that we need to invest early and continuously in not only the science that's being done, but in the relationships and knowledge translation strategies that allow that science and evidence to be translated into wise, thoughtful, and data-driven solutions.
Maybe just adding a little point about that. I think this is the vision. How do we actually do that? We don't know exactly, and we also need help from people to really, like in terms of making the best use of the platforms, especially CanCOVID, for instance. It's good that we have a good starting point, I think, but then how do we actually then activate that and engage everybody such that everybody really can contribute? It's still a work in progress, I think is fair to say, and for which we need help and people to come in with additional ideas beyond the one that we've talked about here today.
Yeah, from my perspective, really hard to say for sure. I agree with previous panelists. Two things. I think on one hand, people are much more networked right now because, one individual or one community cannot solve this. And so you have to work together. And there's a lot of bridges currently being built between organizations. And, I hope that this will carry on, and whatever the next emergency is, because it might not be infectious disease emergency, that, we'll use that knowledge and be better connected, I would say. That's the main one. And then the second one that I see a lot of, especially coming out of the granting councils and from our office as well, there's a lot of attention being paid to the research, COVID-19 research and the barriers that it's experiencing, and trying to remove those barriers actively and proactively, even before they arise, if possible, so that research can proceed as quickly as possible. And I hope that some of that approach will remain, or the kind of become more generalized to other communities. It's hard to say, but I really enjoy seeing this active engagement.
Well, I think that's a really hopeful place to end this panel. So to wind things off, I just want to say a huge thank you to all of our panelists for taking the time to speak with us today. I know I learned a lot. I hope that our attendees also learned a lot. I know Emma is on, and she's going to share a screen right now that just has a couple of links to some of these pages that we chatted about today. Also, for those of you who attended, this will all be, this has been all recorded. And so if you attended today, you'll get a recording of this webinar. And if your question didn't get answered, feel free to flip it my way and we'll do our best to help you out. But thank you all so much for coming. And thank you so much to all of our panelists again for joining us today. We really appreciate it. So thank you so much.
Thanks for organizing.
Thank you.
Thanks for organizing.
Yes, thank you very much. It's a great experience.
Thank you so much.
And my mom is clapping. Sorry, my mom is sitting here. We took my mom out of her home a few weeks ago, and she joins most of my meetings. Mama, do you want to come and say hi? Hi. Just to show everyone, this is what a lot of this is about. Okay. This is my mom, Maureen. Yeah. She's cheering for me while I'm doing interviews.
Thanks, everyone. Take care.
Thank you very much. Bye. That was great. It was great.